Hello friends, in the previous lectures we discussed about the 25% of the problems, that is menstrual related. The second most problem which I feel is more gynecological is PV discharge. Okay. So that is something which I will discuss today. And nothing much, okay. If you know few things, you are sorted. So as I told, it's almost 13% of your patient complaints. So first you should know what is physiology, what is pathology. So there can be even physiological causes of PV discharge. There can be a pathological causes. So basically, I deal this as, so again coming to stats. That's how I start my class. So physiological cause, then pathological cause. So in pathological cause, you might have infectious cause, which is most common. Okay. Then you will have hormonal cause, any imbalance in hormone or any atrophic causes, and something to do with malignancy causes. And again, the basic way I would like to devise is others. That is any foreign body insertion like copper T, anything, or any fistulas. And again, in fistulas, you might have urinary problems. That if you can see, urine, that is something to do with vesico-vaginal fistula. You see feces, recto-vaginal fistula. This again comes about 10%. Again, I told combination of symptoms. So you know the stats. Now you should know what is physiology and what is pathology. So when do you say it's physiology? See, I will talk with respect to. Want me to use other color? Okay, fine. Talk about color, odor, texture. If it's bad odor, pathology. If it's dirty color, white, green, and pathology. If texture is not normal, then that's pathology. So what is physiology? You can have in physiology also further classified as pregnancy related. No, lochia rubra, lochia alba, all those things. And also even in ovulatory discharge you can get. Why do you think ovulatory discharge is necessary? So that for lubrication purpose. Okay. And even postpartum discharge, that is something to do with this itself. Okay. This is all related. Okay. Rubra alba. Pregnancy related, in this you can take it here, and pregnancy related you can do something as leukorrhea, milk production, all those things. Infection, that is something separate, okay, that I will deal with. In a hormonal atrophic condition, especially in estrogen excess, you will have thick mucoid, thin kind of thing, thick, basically thick discharge, okay. And also if it's a menopausal woman, okay, less hormone, so thin discharge, okay. Then malignancy related cause, most likely will get blood. So understand one thing. So it's PV discharge. What you can get? You can get any fluids, or you can get blood, or you can get urine, or you can get feces. If these two are there, then the 10% of symptoms, something to do with fistulas. Blood is there. Most like if for God's sake, please don't say in menarche, in menstruating woman blood is there, it's a PV discharge. Nonsense. No, I am talking about either premenopausal or postmenopausal. Most likely a malignancy. Most likely. Okay. Then in fluids again you might have different color, odor. You have physiology or pathology. This is something very, very, very basic. You should know what you are seeing in the discharge. This I talk blood, most likely malignancy. And even this also constitute a major chunk, foreign body insertion or IUCD, all those things. It's also major. So in today's class, something to do with PV discharge, because it's something which is very, very, very basic, and it comes up with many other concomitant symptoms. They might have one LAP, that is lower abdominal pain. Then most likely think about infection. Okay. So now you know what is normal, what is pathology, and what are the other conditions of per vaginal discharge. So basically, infectious cause is something which I would like to consider next after physiology. So now coming to our anat physiopatho approach itself. Yes. So discharge, I would like to think locally first. So basically, if you have any vaginosis, cervicitis, endometritis, salpingitis, oophorectis, all will present with PV discharge. Many will present, or it can be caused as PID. And if you insert something like copper tube, so foreign body insertion, also can be vaginal discharge. Then if hormones are not acting properly, hormonal cause. Just let me take up in physiology. Something I have to do. Atrophy vagina. Sorry, I mean atrophy, all those things. And also pregnancy is physiology. So all those conditions also is leukorrhea, then lochias, something to do with physiology. And pathology, nothing much. Infection is something which you need to do. Some again infection I will take up as a separate topic. I mean, because that's something which is important. This is something physiology, if you know, you are soft. But again, I will take up that part later. Infection, basically all this vaginosis, candidiasis, all those things. Then for maintaining normal epithelium, you also need hormones, environment, then genetic. So if this is the abnormal, then you will have discharge. Okay. So investigations here I would like to think of is, if it's infection, mostly micro, mostly culture, all this stuff, or else basic CBC and panel to look for infection. That's it. Then also hormone panel if you want, not everywhere. Okay. Treatment, if it's infection, antibiotics or something to do with hormone replacement therapy. Okay. So coming to statistics, I touched what are the causes, but coming to statistics proper, no, let me finish it off. See, almost if it's a PV discharge, let me use a better font. Okay, PV discharge, almost 50% of the cases will be bacterial vaginosis. Okay. 10% of the cases can be ST. One more thing here. If it's infection, no, it can be sexually transmitted or non-sexually transmitted. One more thing which I want to add. Then 25%, I mean almost major thing is candidiasis. Then or this trichomoniasis, 15% almost. Then hormonal thing I will talk, atrophic vaginitis, follows 8%. Then malignancy related things which forms almost 5%. Then foreign body, others I will classify it as others, right? Foreign body, 3%, 1 to 3%, and 10% is physiological. So what is the inference from this? See, I am not saying that I am not a mathematician at the end of the day. I am a biologist, but use mathematician to help my clinical practice. So you should know infection almost 50, 60, 50, 75, 85, 90% of your cases something to do with infection. So this I will do a separate video. Fine. Then 10% is pregnancy. If you know this ruled out, then something about infection is what you need to think. And the hormonal balance post menopausal and all, you have to think this. So see why statistics is important. Understood. Now you know where to concentrate. Not that infection is important in singing. No, this is something statistics. This is common, so you should know. Got it? And that's it for today. For PV discharge. Next class we'll take about the importance of various other infections. Okay. In this class we discussed about the PV discharge, which constitutes 13% of symptoms, and what do you see in a discharge, like fluid, blood, urine, or feces. Based on that, we define what is physiology and what is pathology. In pathology, what are the other conditions like infection, hormone, and malignancy? Again, with something to do with Robbins itself. Then in others also, we discuss something about foreign body, and fistulas. Then we discussed what are the causes of physiological this thing. Then again we came to our anatomy, physio and patho approach with investigations. It's basically to do with infections only. So basically I've touched only on that. Then the statistics which made us to think that you know physiology, after ruling out, think about infection. Then if it's a postmenopausal, think about atrophic or malignancy. Postmenopausal. Then if she's sexually active enough, think about infection first. First think about pregnancy, then rule out infection. Okay. That's it for today. Next video we'll discuss about the infection per se in proper. Okay. Thank you.